Hello again, Hawaii, and welcome to another edition of the Weekly Dose. I'm Brooks Bear. I am fortunate enough to work for the Hawaii Department of Health. And today on the Weekly Dose, a really important topic, something that a lot of you are going to notice and you're probably going to have questions about. I'm talking about an impending change to the data page on the Disease Outbreak Control Division data page is hosted by the Hawaii Department of Health. And here to talk about that change is the state epidemiologist, Dr. Sarah Kemble, and another epidemiologist who works with us at the Department of Health, and that is Dave Johnston. Thank you very much for both taking the time with us today.
Thanks for having me.
Glad to be here.
All right. I've heard a lot about this. It deserves some explanation. Dr. Kemble, let's start with you if we can. What are we going to notice here coming up on Wednesday, the 19th of May?
So starting on Wednesday, in addition to seeing a table with the confirmed cases, you'll also see probable case counts.
Okay, so we've got confirmed cases, probable cases. Dave, what's the difference?
So a confirmed case is an individual that has a confirmatory test result. So that would be like a PCR test. A probable case is somebody that either has a non-confirmatory test result, so like an antigen test, or they're symptomatic and have some kind of exposure to another case. So it could be somebody in their household that they had close contact with, something like that, but they didn't end up getting that confirmatory testing. And so we would consider them a probable case.
Okay, so I have someone in my household who tests positive for COVID with a PCR test, and then I come down, I exhibit symptoms, but for whatever reason, I don't go and confirm my illness by taking a PCR test. But boy, all signs would point to me having it, and thus I would be a probable case.
Yep, exactly.
Okay, now, how many of these probable cases are there? Because from what I understand, we're not just going to grab probable cases going forward. We're going to go back and get all the historical probable cases, add them to the dashboard at one time. So there's going to be at least a one-day significant jump in the number of cases.
Yeah, there's we've been recording probable since the beginning of the pandemic, and so it'll be a total of about 1,600 cases being added. But again, those are the majority of those are historic cases, so they're not all recent activity. These go all the way back to March of 2020, and so those will be on one day on Wednesday. You'll see that increase in our total counts of those getting added to it.
Okay, a big jump on Wednesday. Going forward, what might the difference be now that we'll be adding in and including these probable cases?
It shouldn't be too significant. It really depends on the activity that's in the state. But in the past, we've probably seen between 10 to 20 extra cases a week. But again, it can vary. If there's more activity, that'll be higher. If there's less activity, it'll be lower.
Of course, much of our behavior is really dictated by what we see in the new case counts. When we see high cases, we're troubled. When we see low cases, we're pleased. And our tier system has been based on the case counts. So, Dr. Kemble, how much might this affect the tier system?
So I don't think it will have a very big impact on what we see in the 7-day averages, which is what we use for the tier system right now. And that's for a couple of reasons. One is that many of the probable cases go on to be confirmed, so they don't stay as a probable case. The other is that right now, the total number of tests that come in as antigen tests is relatively small compared to the number that we receive for PCR and other molecular testing. So it really is a small proportion of the cases that we receive.
Dave Johnston, Dr. Kemble says a lot of the probable cases are later confirmed and they become confirmed cases. Do we know how often this happens or what happens when a probable case becomes a confirmed case? I mean, are we worried about double counting here?
No, we're not worried about double counting. If a probable case does go and eventually, decides to get a confirmatory test, they would be recategorized as confirmed. So they would move from the probable category to confirmed. And so you might actually see that in the tables that we have on our site you might actually see some days that the probable counts go down, and that's because those cases have probably moved over to confirmed cases. So everybody would only be counted once in our tables.
And Dr. Kemble, why are we doing this now? Why wasn't it done before?
So we actually anticipate seeing more antigen testing as time goes on. We're seeing a lot of change and development in testing technologies throughout the pandemic, and probable cases as defined by antigen tests is something that's becoming a more common practice. So it's important for us to be able to capture what's actually going on with the COVID pandemic, and a complete picture of that includes these probable cases.
When the probable case counts are posted for the first time on Wednesday, the 19th of May, is there anything that kind of is going to make me scratch my head or might warrant further explanation?
One thing that you will notice is the difference in the number of probable cases across the different counties. And that's dependent on how much antigen testing has been performed in the different counties, and how well it's being reported in that electronic format so that we receive it. So for instance, Maui has a larger number of probable cases than many of the other counties, proportionate to their total case count. So you will notice a bigger number of probable cases for Maui County. That's partly because they've been using antigen tests for a while now to get a jump start on outbreaks, to be able to detect right away when people are positive. And then often those are followed up with confirmatory tests, but not always.
All right. Hey, you two have done a wonderful job explaining this change to us, and I appreciate that. In fact, for more than a year now, you guys have been getting up in the wee hours of the morning to count cases, tabulate things, confirm and verify information before we push it out to the public. And then I get emails from you late at night too. So I know you guys have been working extremely hard, really at a sprinter's pace, and this has been a marathon effort. So thank you very much for the time. Thanks for the work in trying to keep Hawaii safe. And thanks for appearing today on the Weekly Dose.
Thank you.
Yeah, thanks for having us.
All right. Two epidemiologists, our guests, Dr. Sarah Kemble and Dave Johnston. We appreciate their time, and we appreciate your time, Hawaii. You've done a wonderful job. We're getting closer to that finish line. You know, things are moving in our favor, but we're not there yet. So please continue to mask up when you're around people, especially people that you know have not been vaccinated, or even if you don't know whether or not they've not been vaccinated, you want to make sure that you are protecting yourself and them by masking up. And you know what? When you've got the opportunity, we'd love to see you get vaccinated. You can walk into clinics around the state, or you can make a reservation, make an appointment by going to hawaiicovid19.com. The vaccines are absolutely free. So what are you waiting for? Time to mask up and move on with life, Hawaii. I got to make sure I'm raring to go. We'll see you very soon on another edition of the Weekly Dose.